We have a young man with who suffered a head injury with a head laceration. Let's go take a look. Did you pass out?
No.
Do you feel dizzy?
I did, but I don't feel dizzy anymore.
And do you have a headache?
Yeah.
I understand. Let me take a look at your wound and take a look. Let's see how big this opening is. Oh, it's pretty big. So, tell you what, why don't you continue to hold pressure to prevent further bleeding. Let me do a quick neurological exam. Make sure you're not suffering from any major head injuries or concussion. So just look at my nose. Let me make sure your pupils are equal, round, reactive to light. Great. They are. Put it back. Now, continue to look at my nose. Follow my finger with your eyes. Look this way. Look up. Look down. Fantastic. Now, you take your tip of your finger and touch the tip of my finger, and then touch the tip of your own nose. Touch the tip of my finger. Okay, let's swap hands. Can we swap hands? And then try to touch the tip of my finger.
It's got blood on it.
Oh, that's okay. That's okay. Touch the tip of your nose. Touch the tip of my finger. That is great. Fantastic. Now, we'll get our radiology tech to come and take you to our CT to get a CT scan of your head to make sure you don't have any bleeding inside your head.
So it's...
I'm going to just explain the instructions. You're going to go in and out of the CAT scan 3 times, okay? It's going to take us 5 minutes, not more. Please follow instructions, okay?
Assessing traumatic brain injury or head injury is very important, and the best place to do this type of assessment is in emergency room. Emergency room physicians, we are equipped with the expertise to assess the injury, the location of the laceration, and then decide whether a CAT scan of the head is indicated. We do not like to image children readily, fearful of radiation exposure. So the criteria to do a CT scan requires the in-depth knowledge of an experienced emergency physician. This is why a head and neck injury should be assessed in the ER, where this is the best place to have these type of injuries assessed.
Don, are you okay?
Yeah.
Okay. You can go back to your room.
Well, I looked at your CAT scan, but thankfully there's no evidence of internal bleeding. But I'm afraid you might be suffering from head concussion, which is a type of head injury. Well, it is important to get a CAT scan to assess traumatic brain injury, and typically we show patients similar to one like this to the patient and patient's family members would really enjoy and see their own CAT scans and understand what we're talking about when we're talking about if there is internal injury or there is an internal injury and what exactly we are looking at. So looking at a clearer picture here, here is the patient who just suffered a head injury. Right, put it here. And let's go through the different slices. So we go from the top of the head, and we're going down in about 5 centimeter intervals. And at the beginning of the brain, we're going down deeper. As you can see, that's the bone. Bone is very white in color. The brain has various, we call it sulci, these grooves. And the CAT scan, in a way, is easy to read because we're looking for asymmetry. Typically, the injury is on this side of the brain. And if there's something that shows up on this side of the brain that's not on the other side, or vice versa, then there's a high likelihood there may be something wrong. So we have a control side always to compare. Very few problems or trauma will cause a brain injury that is symmetric and make both sides of the CAT scan look exactly the same. So that's the kind of our little trick that we use, kind of a cheat. To find